A new University of Florida health study shows the body mass index, or BMI, is a poor predictor of future health.
Doctors have long used BMI as a quick screening tool, but it doesn't show the entire picture. Dr. Zorba Paster is here today with more. Hi, Zorba. Good to see you.
Good to be here.
Tell us a little bit about this study.
Well, BMI is height and weight, and it's easy to measure. You go into your doctor's office, electronic medical record, got your height, got your weight, and it may say that you're overweight or obese when you're not. And I'll give you the perfect example. I was working in Wanakee the other day, and a guy came in who was muscular and athletic, and the BMI said he was 27, which would imply that he's overweight. He was not overweight. But if you looked at him, I mean, if you actually looked at him, you looked at somebody like that, you would realize it also is the relationship of your belly to your waist. In other words, it's really another measurement that makes it. So for men, it should be 1 or less. And for women, it can be 0.8. So you have to look at that number. You measure your waist.
You're measuring the distance between your...
No, you're measuring you're measuring your circumference around your belly button.
Okay.
And the circumference around your waist. And basically, if you're overweight, you're going to have more abdominal fat, and that turns out to be the risk factor for heart disease.
Interesting.
So we're over measuring when we do the BMI. We're getting a lot of people who are really very muscular, and it says they're overweight doesn't mean anything.
And that can be problematic too, because if someone is looking and feeling good, but the BMI is telling them another thing, that could lead to eating disorders and other issues.
That's right. Like I'm really overweight and I'm not really overweight. And also from a point of view of, we'll say, things like life insurance. You're buying whole life insurance. If your BMI is too high, then you'll be rated at risk when you actually may be muscular and an athlete. There also are some other measurements. You can buy devices called impedance devices. Go on the web and you can find it. You put your hands in there and your feet, and it'll measure your body fat. And body fat changes with age. So when I look at myself in the mirror at 78, I may be the same weight that I was at 48, but you know what? I don't look the same at 48. So there's a change in normal body fat that occurs as we get older. We have more body fat, but we may be healthy. So you want to look at the chart, you want to measure belly fat, because that's really the issue, and you have to look at BMI and say, maybe it doesn't mean exactly what we thought.
So you have to be more thorough with your patients.
Absolutely.
And look at things like cholesterol.
Correct, exactly. You have to look at everything together. And BMI, it's been easy to measure, but the real point about this is the fact that it really has not been accurate in terms of predictions. So a lot of people measure high BMI, but they actually live a long life.
Yeah. Do you think it's true that you can be thin and unhealthy and heavier and healthy?
Absolutely, because there are all these other factors. It's whether or not you have balance, whether or not you have strength, it's your cholesterol levels, it's a whole bunch of things. It's not one measurement. And then it's family history. It's also how we live and we progress in the future that makes a difference, because if you start better health now, you will live longer.
Yeah.
Also, shout out to us. There was a fly buzzing around. Did you didn't see that? We didn't break.
You didn't skip a beat.
I noticed it.
Always
well done, Zorba.
Good to see you.
Good to see you.